Gentlemen, in America today, more than 1 in 3 men over 50 are quietly struggling with a problem they rarely talk about. Not heart disease, not diabetes. I'm talking about something far more personal. Weak blood flow, fading testosterone, and yes, the way you masturbate. Most men don't realize this, but the way you touch yourself can either protect your sexual health or slowly destroy it. Now, I know this is a private subject. Many men my age and older feel uncomfortable even saying the word. But here's the truth. How you handle self-pleasure after 50 can directly affect your testosterone levels, prostate health, erectile strength, and even your heart circulation. And yet, almost no one talks about it. Doctors don't bring it up. Men feel ashamed to ask. So what happens? Silent suffering, silent damage, silent loss of the very manhood that makes life feel alive. But let me tell you something very important. Masturbation itself is not dangerous. In fact, when done the right way, it can actually keep your blood vessels flexible, protect your prostate, and even release hormones that fight stress. The real problem lies in the mistakes men make. Mistakes like rushing, mistakes like ignoring circulation, mistakes that might seem harmless, but over time, they can shrink your testosterone, damage your erections, and age your body faster than you ever imagined. Could this be happening to you? Could the habits you've had for years be secretly working against your health? That's exactly what we're going to uncover today. In this video, I'll reveal the 3 biggest mistakes older men make when masturbating, mistakes that block blood flow, weaken erections, and increase prostate risk. And more importantly, I'll show you how to do it safely, in a way that keeps you feeling like a man in his 20s again. So if you're over 50, if you're over 60, or if you care for someone who is, stay with me, because this is not just about pleasure. This is about protecting your body, your hormones, and your future. And before we go further, I'd like to ask you, have you ever noticed changes in your erections or energy with age? Drop a quick comment below, because your experience might help another man who feels alone in this. Gentlemen, you are not alone. And by the end of this video, you'll know exactly how to protect your health and your manhood for years to come. Gentlemen, the first and perhaps most damaging mistake I see in older men is rushing through masturbation. I've had countless patients, men in their 50s, 60s, even 70s, who tell me, "Doctor, I finish quickly. I just want to get it over with." At first, they think it's harmless. But here's the hidden danger. When you rush, you rob your body of the very benefits that healthy self-pleasure provides. Think about it this way. Your penis is not just a sexual organ. It's a network of blood vessels, nerves, and smooth muscle. Each erection is actually a cardiovascular event, like a mini workout for your arteries. But if you rush, if you force yourself to climax too quickly, you're cutting off that workout before it's complete. Over time, this leads to weaker erections. It's because the vessels never fully expand. Lower testosterone, because your body doesn't release the same hormonal signals with rushed arousal. And even higher prostate risk, because healthy fluid release depends on full circulation, not quick tension. So what's the right way? The answer is surprisingly simple. Slow down. Treat masturbation not as a race, but as a gentle exercise for your blood vessels. Spend at least 10 to 15 minutes allowing arousal to build. Breathe deeply. Let circulation expand naturally. Why does this matter? Because when you take your time, blood fills every chamber of the penis. Nitric oxide is released. Your vessels stretch. Your prostate drains fully. And your body gets the full benefit nature designed. This is why I tell my older patients, masturbation after 50 should be treated like physical therapy. If you rush, you lose the benefit. If you slow down, you actually protect your manhood. Could this small shift, just giving yourself more time, be the first step to feeling like you're 25 again? Absolutely. And in the next, we'll look at a second mistake men often make. One that silently damages circulation even if you take your time. But before we go on, if this is opening your eyes, hit the like button. It helps more men find this message. and it tells me you want me to keep sharing more powerful, science-based health advice. Gentlemen, the second mistake I see all too often is using too much pressure, the wrong kind of grip. Now, why does this matter? Because your penis is a very delicate organ. It may look strong, but inside, it's built of tiny blood vessels, fragile nerves, and soft, spongy chambers. When you use an overly tight grip, what many men jokingly call the death grip, you actually train your body to respond only to that unnatural pressure. What happens then? Erections become weaker with a partner because normal touch feels too soft. Sensitivity drops because the nerves get dulled over time. And here's something most men don't realize. Heavy squeezing can damage the microvessels, leading to scar tissue and poorer circulation in the long run. I once had a 62-year-old patient who came to me embarrassed, saying, "Doctor, I just can't feel normal stimulation anymore." When I asked about his habits, he admitted he'd spent years using a very tight, fast grip. His body had been reprogrammed, and it took months of retraining to restore his sensitivity. So what's the safer, healthier way? Use a lighter touch. Imagine you're encouraging blood flow, not strangling it. Switch techniques sometimes. Different rhythms, different movements, so your nerves stay responsive. And above all, avoid friction that feels rough or painful. If you wouldn't treat your eyes or skin that harshly, don't treat your penis that way either. Could a simple change in technique really protect your manhood? The answer is yes. Because the less damage you do to your vessels and nerves, the longer your sensitivity, erections, and hormonal response will last. This is why I remind older men, your grip should support blood flow, not block it. And in the next, I'll share the third and perhaps most dangerous mistake, one that silently harms not just your erections, but your prostate health as well. Before we continue, let me ask you, have you ever noticed a difference in sensitivity over the years? Drop a quick comment, because sharing your story might help another man realize he's not alone. Gentlemen, the third and perhaps most dangerous mistake is this: ignoring your prostate health during self-pleasure. Here's what many men don't realize. Your prostate isn't just some small gland sitting quietly beneath the bladder. It plays a huge role in your sexual health, your fertility, and even your hormone balance. And after 50, this gland often becomes the weak link. When men rush, when they use too much pressure, or when they avoid regular release altogether, the prostate suffers. Stagnant fluid builds up, inflammation rises, blood flow decreases. Over time, this can lead to frequent urination at night, difficulty starting or stopping urine, painful or weaker erections, and yes, even higher risk of prostate disease. I once treated a 68-year-old gentleman who hadn't ejaculated for nearly 2 months. When he finally did, he noticed pain and burning. His prostate was swollen, irritated, and congested. With proper therapy and healthier self-pleasure habits, his symptoms improved dramatically. So what's the healthier approach? Make sure ejaculation is complete. Don't stop midway. Allow your prostate to empty fully. It's like flushing an engine. Support circulation with slow, steady arousal, not rushed tension. And pay attention to warning signs: pain, burning, or difficulty urinating. These are your body's alarms, telling you something is wrong. Why is this so important? Because protecting your prostate also protects your testosterone, your erections, and your overall vitality as a man. So here's my advice as a urologist. Treat masturbation as part of your prostate care, not just a private act, but a way to keep the engine running smoothly. Could ignoring this small gland be silently stealing your manhood? Absolutely. But the good news is you can take control. With awareness, with better habits, and with consistency. Now, we've covered the 3 biggest mistakes older men make with masturbation. 1. Rushing and ignoring circulation. 2. Using too much pressure. 3. Forgetting prostate health. But our work doesn't stop here. In the next, I'll explain how to masturbate safely, after 50 and 60, step by step, so you can avoid these mistakes and actually use this natural process to protect your body. Before we move on, if you're finding this valuable, Tap the like button and share this video with a friend. You never know who might be silently struggling, wishing someone would explain this to them. Gentlemen, now that we've uncovered the 3 most dangerous mistakes, let's shift gears, because knowing what not to do is only half the battle. What truly matters is knowing the right way to take care of your body. And yes, that includes how you masturbate after 50, 60 and beyond. Think of this as a roadmap, a step-by-step process designed to keep your blood vessels strong, your prostate healthy, and your testosterone active. Step 1. Prepare your body. Before you begin, pause for a moment. Take 2 to 3 deep breaths. Relax your shoulders. Let your circulation settle. Why? Because arousal is not just in your penis. It's in your nervous system, your heart, and your mind. A calm start leads to stronger blood flow, better sensitivity, and a healthier release. Step 2. Focus on circulation, not speed. Remember what we learned about rushing? Instead, think of masturbation as vascular exercise. Allow at least 10 to 15 minutes for arousal to build naturally. Breathe steadily. Pay attention to how the blood fills your penis. This is where nitric oxide is released, the same chemical that keeps your arteries young. Step 3. Use gentle, varied touch. Avoid the death grip. Instead, use lighter pressure. Switch techniques every few minutes. Change rhythm, change pace. This trains your nerves to stay responsive, so you can enjoy sensitivity with a partner too. Here's a question. Could this one change, reducing pressure, be the difference between numbness and full sensitivity? The answer is yes. Step 4. Support the prostate. Don't stop suddenly. Don't cut yourself off halfway. Allow the ejaculation to be complete. That flush keeps the prostate healthy, prevents congestion, and supports hormone balance. And if you ever notice pain, burning, or difficulty urinating, listen to your body. Those are warning signs to seek medical guidance. Step 5. Aftercare matters. Once finished, don't just walk away. Take a few more slow breaths. Drink a glass of water. Remember, ejaculation is a full-body event, like a workout. Your heart, your vessels, your glands, they've all been engaged. Recovery is part of health. Gentlemen, masturbation after 60 is not something to be ashamed of. It is not dirty. It is not a sign of weakness. When done correctly, it's a form of self-care, protecting your arteries, your prostate, and yes, your manhood. Could it really help you feel 25 again? For many men I've treated, the answer is clear: yes. Because when you protect blood flow, protect your nerves, and protect your prostate, you protect the very foundation of male vitality. And in the next, I'm going to share something even more powerful: the lifestyle habits that multiply these benefits, natural ways to boost circulation, testosterone, and sensitivity outside the bedroom. But before we continue, I want to hear from you. Have you ever tried slowing down or changing your technique and noticed a difference? Drop a comment below. Your story might help another man who thinks he's the only one facing this. And if you're finding this eye-opening, don't forget to subscribe. This channel is here to guide men, caregivers, and families with real, science-based advice that protects health and dignity at every age. Gentlemen, here's the truth. Masturbation done the right way is powerful. But if your daily habits are working against you, even the best technique won't be enough. Your body after 50 is more sensitive to lifestyle choices than ever before. Every meal, every drink, every step you take affects your circulation, your prostate, and your testosterone. So let's break down the habits that matter most. Habit number 1, move every day. Sitting too long is the silent enemy of male health. When you sit for hours, blood flow to the pelvis slows, your arteries stiffen, your testosterone dips. The solution? Gentle daily movement. Even a 20 to 30-minute walk can improve pelvic circulation, lower blood sugar, and support stronger erections. Add light resistance training twice a week. Squats, push-ups, or resistance bands. These boost testosterone naturally and keep your vessels flexible. Remember, your penis is a vascular organ. If you don't train your body, your erections pay the price. Habit number 2, eat for blood flow. What you eat either opens your arteries or clogs them. Processed foods, excess sugar, and heavy fried meals damage the same blood vessels that supply your penis. Instead, focus on leafy greens like spinach and kale, rich in nitrates to support nitric oxide, healthy fats from olive oil, nuts, and avocado to protect your hormones, berries and citrus fruits, packed with antioxidants that keep your vessels young. Could one bowl of spinach really support better erections? Yes, because the same nitrates used in ED medications are found naturally in these foods. Habit number 3, prioritize sleep. Poor sleep lowers testosterone faster than almost anything else. One bad week of sleep can drop your levels by 10 to 15%. So aim for 7 to 8 hours. Go to bed at the same time. Keep the room cool and dark. Your hormones reset while you rest. Without sleep, no technique, no supplement, and no exercise can fully protect your manhood. Habit number 4, limit alcohol, quit smoking. Alcohol in moderation is fine, but heavy drinking dulls nerve sensitivity and lowers testosterone. And smoking? It's the single fastest way to destroy penile blood vessels. I've seen men 55 who looked 75 inside their arteries simply because of tobacco. Gentlemen, nothing ages your erections faster than smoke. Habit number 5, stress control. Chronic stress raises cortisol, which lowers testosterone and constricts blood flow. Your body doesn't care if the stress comes from money, relationships, or traffic. The result is the same: weaker erections, weaker energy. What works? A deep breathing, meditation, gentle stretching. Even 5 minutes a day can reset your nervous system. So, here's the bigger picture. If you practice safe masturbation, but ignore lifestyle, your results will be limited. But if you combine both, proper technique and healthy daily habits, you create a foundation that protects your prostate, your circulation, and your vitality well into your 70s and 80s. Gentlemen, aging is not the end of your manhood. It's an invitation to take smarter care of yourself. And in the next, I'll share what to watch for. The warning signs that something may be wrong. Because sometimes, changes in your erections or masturbation habits aren't just about aging. They can be red flags for deeper health issues. Before we move on, if this has been helpful, hit like. And if you know a friend, a brother, or even a son who might benefit, share this video. You never know whose life you could change. Gentlemen, I want to be very clear here. Not every change in your erections, not every change in your masturbation habits is just aging. Sometimes it's your body sending an urgent signal. And if you learn to listen, you may catch serious health problems early, when they can still be treated. So let's look at the biggest red flags. Warning sign number 1, sudden erectile weakness. If you used to have firm erections, but suddenly you can't maintain them, don't just blame age. This can be an early sign of cardiovascular disease. Why? Because the arteries in the penis are smaller than those in the heart. They show damage years earlier. I've seen men who ignored this, only to have a heart attack later. Your body was warning you. Don't let that warning go unheard. Warning sign number 2, pain or burning. During ejaculation, healthy masturbation should never be painful. If you feel burning, stinging, or deep pelvic discomfort, this could mean prostate inflammation, infection, or even early prostate cancer. Gentlemen, don't ignore pain. Pain is your body's way of saying something's not right. Warning sign number 3, blood in semen or urine. This one frightens men, and it should. Blood in your fluid is not normal. It can be caused by infection, but it can also signal prostate or bladder disease. If you ever notice this, see your doctor immediately. Warning sign number 4, loss of sensitivity. Some change in sensitivity with age is normal, but if your penis becomes almost completely numb, if you can hardly feel anything, this could be a sign of nerve damage. And nerve damage often comes from diabetes or severe circulation problems. Remember, your penis is a window into your health. Warning sign number 5, complete loss of desire. If you've lost all interest in sex or masturbation, and it's not caused by stress or medication, It could be a symptom of low testosterone or even thyroid imbalance. These are real medical issues, and they can be treated. Gentlemen, here's the truth. Your body whispers before it screams. Masturbation is not just a private act. It's a barometer of your vascular, hormonal, and prostate health. So let me ask you, have you noticed any of these warning signs? If yes, don't stay silent. Drop a comment below, or more importantly, schedule a checkup. Remember, real strength is not in hiding problems. Real strength is in facing them head on. Gentlemen, we've covered a lot today, and maybe for the first time, you've heard an expert explain something most doctors never talk about openly: how to masturbate safely, effectively, and healthily after 50, 60, or even 70. Why does this matter so much? Because this is not just about pleasure. It's about your heart. It's about your blood flow. It's about your confidence as a man. When you protect your body from the 3 mistakes we discussed: rushing, relying only on pornography, and ignoring your prostate, you're not just protecting your sexual health, you're protecting your life. I want you to remember this. A weak erection is never just bad luck or getting older. It's often the first sign of clogged arteries, low hormones, or prostate stress. So take this seriously. Treat your body with respect, because you deserve to feel alive, healthy, and confident again. And here's the truth. It's never too late. I have patients in their late 70s who made these changes and told me, "Doctor, I feel like I'm 30 again." So let me ask you one final question. Do you want to be the man who gives up, or the man who takes back control? If you're choosing control, then stay with me on this channel, because in my next videos, I'll reveal simple foods, daily habits, and powerful science that can make you feel younger, stronger, and full of life again. Before you go, do me one favor. Hit the like button if you learned something new today. Drop a comment below if you've ever noticed these mistakes in your own life. You're not alone. And subscribe, because I promise you, the journey to better men's health is just beginning. Take care of your body, protect your confidence, and never settle for just aging. You are still the hero of your story. This is Dr. Michael James, reminding you that a strong body, a strong heart, and a strong manhood all start with knowledge. Take care, gentlemen.